A vaccine for HIV could be a step closer as scientists begin trials of a new drug in London and Africa. 64 volunteers are being recruited to take part, all of them judged to be at the lowest risk of contracting the virus. Experts have spent 7 years making sure this treatment is completely safe. Now they want to find out what kind of immune response it produces in healthy adults. Our health and social care correspondent, Victoria MacDonald, reports.
Every day, 7,000 people across the world are newly infected with HIV. Millions have died from AIDS. It's a cruel and often devastating disease. And that only adds to the pressure on scientists to find both a cure and a vaccine, something to protect those from the virus. Now, in this London laboratory on the second floor of the Chelsea and Westminster Hospital, a new vaccine trial is being launched, in conjunction with 2 other centres in Uganda and Kenya. It's led here by Dr. Jill Gilmore.
The HIV epidemic continues unabated, and while we've had huge successes with treatment, for every 3 people who go on treatment, 5 people become infected.
So shortly the call will go out for volunteers, just 64 to begin with, aged between 18 and 50, healthy and at low risk of contracting HIV. This is to make it easier to check their immune response to the vaccines.
Of course, this is what everyone wants, a world without AIDS. But so far, the search for a vaccine against this highly complex, highly contagious virus has proved elusive. Indeed, 3 out of the last 4 large-scale vaccine trials haven't succeeded.
Yet lessons have been learned in each case, and they're being put to use here in the trial set up by the International AIDS Vaccine Initiative. The trial involves the use of 2 vaccines, a weakened Sendai virus, a flu-like disease, which will carry parts of the HIV virus into the body, using for the first time a nasal spray. It will target mucosal tissue where HIV begins dividing. The second injected vaccine related to respiratory infections will also carry part of the HIV virus into the body. It's been used safely before. It is expected they will both produce a stronger, longer-lasting immune response. But an AIDS vaccine is not like any other.
For example, polio or measles, what we do there is we attenuate, we take measles and we make it a little safer. So we give a safer version of measles. In HIV, we can't do that for safety concerns because, as I say, the virus integrates, the virus changes. And so we can't just take HIV and make it a little safer and put it in for fear that it will become more aggressive.
Recently, there's been a growing air of optimism in the world of AIDS, like, for instance, the one successful large-scale vaccine trial in Thailand, which proved to be 30% effective. Still not enough, but a start. Yet there are warnings also to be cautious.
The key message we do still need to get across is about prevention, and that's people practicing safer sex, having regular HIV tests, and those people living with HIV accessing HIV care and treatment.
It is now 30 years since the discovery of the HIV virus, and it is also now that researchers are beginning to say, imagine a future AIDS-free.